Hey, Mavericks, we are back again. It is Friday, the 3rd of April already, and I'm sure everyone's head's a little bit of a whirlwind right now as to what's been going on the last 3, 4, 5 weeks, depending on what part of the country you're in. But I'm really excited today. Once again, Serenity app is powering our show, and I can't thank them enough for the work they're putting in for our senior living communities. Once again, they are going to give our senior living providers 3 months free to be able to text, communicate with family members of residents. This is so great as an option right now because of what's going on with a lot of lockdowns, the difficulty in seeing our loved ones that are in assisted living memory cares. So for more information on that, please visit serenityapp.com, and we will have all that information in the show notes. And I'm very excited today because we have Josh Burt coming to us from Soundview Medical. And he lives in Seattle, Washington. He has a lot of firsthand knowledge about what COVID is doing over there because they are further ahead with their recovery than a lot of the other part of the countries are. And so with that being said, I'm Francis, your Chief Curiosity Maverick, and I'm going to kick it over to the ever important Catherine Wells.
It's a new title every day. Thanks, Francis. Great to see everybody. I'm Catherine Wells, the Chief Inspiration Maverick. And before we dive in today, I just want to really quickly let you know what the Mavericks are doing. We have a page on our website called Ignite Hope. You can find it in the menu bar right at the top. And what we're doing here is working to provide hope and inspiration during this difficult time with so many of us feeling isolated or alone or despair at this moment. So first thing we have is our COVID-19 interview series. Today is one of those. You can find all of those on our website. Second, yesterday we launched a text message subscription for 30 Days of Hope. You will get an inspirational or a text message filled with hope to create hope during the next 30 days. So each day you'll get a text message. It's completely free other than your own text message service. So it will charge you if you're getting messages, but it's completely free on our end to you. And then at the end of that 30 days, we will ask you if you would to continue with daily or weekly or a couple times a week, and we'll go with what our audience wants. So please join that. You can find the information on our website. You would text the words Ignite Hope to 27126. Ignite Hope, no space. And then the third thing we're doing is really fun. These little wristbands. Let me see how I can get it. You have to do all this backwards in the camera. So we have these little wristbands. They're $5 each, and they are the proceeds will all go to one of 3 charities. And all of that information's on our website. So please take advantage of that. Now, back to our regularly scheduled program. Josh, welcome to our Facebook Live today.
Yeah, thank you very much for having me.
Yeah, we're excited. So tell our audience a little bit about who you are and a little bit about Soundview so we know what we're talking about.
Yeah. So Soundview's a local family-owned business. We started in Seattle, Washington in 2002. The owner of the company, her name is Laura Berry. She's our CEO still. So we started locally here in Seattle, and then we went regional. So we're in 7 states now. Washington, Oregon, Idaho, Montana, Wyoming, Utah, and Colorado. In those states, we have a Medicaid license to bill Medicaid for supplies. We can go any other state in the nation if it's private pay, but those are the states that we have licenses for Medicaid. Our little tagline is "We're your dependable source for medical supplies for seniors." So that's we work with residential care facilities, which are called something different in every state. In Washington, those are called adult family homes, assisted living facilities, memory care communities, people in their own homes. So kind of the whole spectrum. I've been with Soundview for 17 years. I was actually the first employee at the company. So when I started, I was in college and I saw an ad in the paper for a marketing internship and walked into this little 50 square foot office and haven't looked back since. Kind of jumped off the deep end of the sales pool after graduating college, and yeah, we kind of just took off from there. So that's kind of
exciting. So the business has definitely grown, and your background is this, because this is what you have done since you got out of college.
Yeah, this is pretty much all I have done. Yeah.
Ah, that's fascinating.
Well, I want to go back real quick just for our viewers. Can you help define what is an adult family home? Because I think everyone knows a name differently. So can you kind of describe what it is?
Yeah. So residential care. So adult family home is licensed facility. They can, in Washington State, they can take care of between 2 and 6 residents.
Okay.
It's a little bit higher acuity level than an assisted living facility in Washington. So it's almost like a little mini skilled nursing facility. So they take care of some higher acuity clients. In our state right now, there's currently 3,168 of these adult family homes. What else?
That's a big number.
It's a big number, yeah. But it's a small number compared to some other states. Michigan has like 4,000. Texas has a lot. California has a lot. But every state calls them something different, and numbers-wise are licensed for different numbers of beds. Like Idaho is 4 beds. Oregon is 5 beds. Arizona's 10 beds. So it's different all over the board.
Okay.
In Washington State, we currently work with about 900 of those adult family homes monthly, providing incontinence supplies.
Okay.
What else with adult family homes?
And that's why you're dependable.
Yeah. On a personal note with adult family homes, it's kind of cool. I've got to experience it from both sides. So my dad lived and passed away in an adult family home about 15 years ago. So I've got to experience adult family homes from both the business side of things as well as on a personal level. I also can throw some information in the show notes of this. I have an adult family home Facebook group that I started about 8 years ago that has about 3,500 members in it now. All people involved with adult family homes in Washington, whether that's the owners themselves or resident managers or caregivers or businesses and vendors that work with adult family homes as well. So it's a good networking and resource tool. So we can put the info for that in the show notes as well.
Can I ask what drew you to the adult family home? Because that's one thing Catherine and I are always discussing is these different types of care models. And I think with what's going on with COVID, you're seeing people start to think through care a little bit more, not just a big, beautiful building. So what drew you to that type of care model for your dad, well, especially for your dad?
Yeah. No, I think it's a much more personal level of care. At worst, you're going to have one caregiver for 6 residents, where more likely you're going to have 2 or 3 caregivers for those 6 residents. When you go up to an assisted living facility or even a skilled nursing facility for that matter, at skilled nursing, you're going to have one caregiver for 20 or 40 residents. So it's a much more personal level of care. It's a home-like environment. So you're living in someone's home. A lot of these adult family home providers actually live in the home with the residents and share that space with them. And those residents then think of it as home, not a facility or a community that they live in, but it's their home. Not to say that assisted living or skilled nursing are wrong options. There's going to be a good fit for everybody, whether that is in an adult family home or bringing care into their own home or going to that assisted living setting. I feel like kind of for me, honestly, I would probably thrive more in an assisted living because I'm a people person and I want to do a lot of stuff. But in adult family homes, they do a lot of stuff as well. They bring activities into the home. They don't necessarily have an activity director like an assisted living facility, but they bring in those activities. They do a lot of stuff. They provide great services and great care. And we love adult family homes.
So Josh, you focus on this particular care model, but do you also sell to the larger assisted livings?
We do. We service everything but skilled nursing. Skilled nursing gets paid a little bit differently, so they include the kind of supplies that we provide, and then they end up buying directly from like our manufacturers and distributors that we buy from. But we sell to everybody from private homes to adult family homes to assisted living to everything else that's out there. So yeah.
So how is your business being impacted by COVID-19?
Well, I get about 30 to 50 phone calls a day right now asking if we can provide PPE. Unfortunately, PPE is extremely difficult to get right now, and not a lot of people can get a lot of those needed supplies that people have to have during this time. So we're spending a lot of our time, besides filling orders for the regular supplies that we do, but providing information for homes on where they can get stuff, because we might not be able to get them face masks and isolation gowns and hand sanitizer at this time, but we have groups of people that are hand making face masks that are wanting to share those with people. And a lot of alcohol distilleries across the nation have switched up. Instead of making alcohol, they're making hand sanitizer.
It's exciting to see that. I want
yeah.
to call you and ask you about the homemade masks. I continually hear this. I'm trying to figure out what's real and what's not. And I know our audience probably struggles with this too, because we hear so many different things. Mm-hmm. Are homemade masks useful?
I mean, I think anything covering your face is going to be useful. I mean, even the N95 masks, they're not designed to stop this virus. It's designed to stop the virus spreading. So it's stopping you from touching your face. Instead of, going out in the community and touching something that has COVID on it and then touching yourself. When you touch your face, that's when you're going to get it the most. Now I probably just got it from touching my desk and touching myself.
You did. Now you're done.
I mean, the handmade masks, some people are putting filters inside of them, like a HEPA filter, cutting up a filter that would go in your furnace and putting it in there. I don't know, honestly, if that's going to work or not, but it's better than nothing.
So Governor Polis, and we're in Colorado, both Catherine and I, Governor Polis just issued, I don't know if I haven't read the full thing yet, but they're requiring, if you go out in public, to wear some type of mask. They just did the announcement about right now, whether that's a medical mask, a bandana, something just to help break the ability for you to more sneeze and cough and just spread or touch your face. So they're now looking at it more as just preventing the droplets, it sounds like, from going, which is the bigger items, not so much the actual virus itself, but more
right.
Droplet type stuff. So a woven mask or stitch mask would help reduce the droplet spread, but the virus is still small enough that in theory it could get through, of course. But when it's consumed in a droplet, it might get caught in that mask.
Wow. Yeah. They're breaking news in Colorado right now.
It is. Yeah. They were on the press conference just now, right before we got on. And I was trying to catch up, trying to keep up with, because what we do with these assured assisted living, Josh, as you know, we're trying to stay relevant and up to date with I feel like the information is changing daily.
Yes.
So.
Yeah. And I know that many assisted livings right now are reporting that cases are coming in from their workers who go home at night and then come back. And so this is all a really difficult thing. So how are things in Seattle?
Yeah. I mean, Seattle was the first Washington was the first state in the United States to have a positive COVID result. You've seen it in the news that one of the first skilled nursing facilities in the nation that got it was a local one here in Washington. And I think to date, they've had 60 plus residents from that building that have passed away. It's crazy. It's spreading fast. I think it's great that we're doing this shelter at home, but even at this, people aren't sheltering at home. Like you go to the store and there's people walking around doing stuff. You drive past the beach and there's people hanging out.
Seriously?
Yeah. So it's going to get worse. In Washington, our governor yesterday or the day before just extended our stay at home an additional month. So it's another month of sheltering in place. It's tough. Soundview, we're considered an essential business, so technically our employees are able to go to the office and work. However, before it even came out for the shelter in place, Soundview made the decision to send all of our employees home. So we have about 30 employees on staff right now in those 7 states, and everybody's working remotely from home, trying to do our part to keep everybody safe. Our sales team is not going into facilities right now. Even if it's an emergency, the only people that are going into facilities are UPS drivers dropping stuff off. So.
Well, and I think too, Catherine, this is part of what we want to do. It's this idea of igniting this hope around just following the stay-at-home orders, right? We're in this together. The longer we kind of do it, right, the more we're going to be in this unknown state of how long are we going to have stay-at-home orders. But if everybody would just buckle down and do what they're supposed to, we'd be a lot better off collectively, I believe.
Yeah, and I don't know what's happening, even though, so in Seattle you have the order, but people aren't following it. Are they enforcing it?
It's not a mandatory enforcement at this point. I could definitely see that happening. On a positive note, comparing like Washington to New York, when we both got the stay-at-home notice at our own respective timing, Washington has done a lot better job overall than other states have. And I know that part of the reason why there's so much virus in New York right now is people didn't listen to that stay-at-home. I think people in Washington are doing a better job, but I think there's always room for improvement in every state.
Yeah. And obviously going back with this, the virus spreading, things are doing. We have the challenges. We talked briefly about the PPE. Do you have any ideas on the challenges or solutions for senior living to acquire some of this PPE? What's your input on that? Because that's a recurring theme across social media and across the news.
Yeah, the difficult thing is like our distributors and manufacturers, they have the product, but they're limiting it and they're only selling it to hospitals and clinics and first responders at this point.
Okay.
Not to say that assisted living facilities and adult family homes don't need them. They do. Unfortunately, like medical supply companies in our position aren't able to get them and sell them. In Washington, every local department of health is looking at every case by case to give out the PPE that they've received from the national stockpile. So all of these adult family homes have the ability to get PPE through their local health department. There's a special form that they can send out. I can put some of that information in the show notes as well for you guys. Right now, that's the only thing that we can do is guide people in the direction of where they might be able to get some stuff. So getting PPE through your health department, getting hand sanitizer from distilleries, going with the homemade face masks. Big companies are stepping up too, like Joann Fabrics offers a free face mask pack that has 12 the material to make 12 face masks, and they'll give that to anybody for free if they have them.
But I got to know how to sew, don't I?
But you got to know how to sew.
I have 2 sewers in my family, and they're doing nothing right now. So
my kids are actually going to start making face masks as part of home ec.
Oh, that's kind of a cool idea, though. That's really cool. I mean, sadly, I think sewing's an actual skill that you would want to know. Like, I really do believe that, and I never learned it.
That'll be the next video: how to sew your own face masks.
They don't want me. No, boy.
I think there's many of those on YouTube right now, but that's actually really good information about Joann's fabric. I did not know that.
Either did I.
If other information like that, let's put that in the show notes. And I encourage our audience to, if you know how to sew, go to Joann's, go get that. Or I don't know how you do that, if you can go there and pick it up or not.
And for our audience to share what you guys are finding. This is a collective group to figure out the resources, right? Like the Joann Fabrics, that's an awesome hint about getting the kit. So thanks, Josh, for that. But our viewers, put in the comment section or let us know what you guys are doing to help the challenge and the solutions facing the PPE shortage, both for us personally as well as for our aging services and medical providers. So please share and let us know what you're doing, and we'll definitely either share it on the show right now or share it after through our comment section.
Yeah. So tell us a little bit about how you're creating hope for adult family homes right now.
Yeah. So, I mean, adult family homes in Washington are flourishing right now. Like, we're in this adult family home boom. They're opening left and right, or were before COVID until this. But it's with the baby boomers coming, right? 10,000 people a day in the United States turn 65 every single day for the next 20 years. Adult family homes, assisted living facilities, everything is going to grow and blossom and bloom. So, I mean, the hope is that these adult family homes will be able to make it through this. I know the difficult thing is a lot of people aren't getting new residents. If residents are getting sick with the virus and passing away, they're having a hard time replacing those. Or even if they just had an opening before this, they're having a hard time finding someone to fill the bed because they can't give tours and can't bring people in and can't can't bring in residents. So I see it definitely being a very hard time for caregivers.
I want to jump in real quick, if you don't mind, Josh, because I think there's some solutions that we just got to start thinking outside the box. We've gone to total virtual tours through Google Hangouts. And so we've been very successful, actually even more successful than before, for the simple reason we are now able to tour families that live all over the country, not just that one that lives local. So it actually is helping families have I'd say a happier decision-making process versus that one that's solely on the ground here leading the way. So I'd I'd like to let anybody from the adult family, anywhere, reach out to me if you want, more info how we're doing that. We're seeing a lot of positive impact from those virtual tours through Google Hangouts because we can get so many more family members involved and make it a family decision, not just, the caregiver that lives local type thing.
Very cool.
That's great. And what do you know, Josh, about testing? So I know there are communities here in Colorado that are accepting new residents, and they're getting them because they're able to test before that resident comes into the community. What's happening there in Seattle and Washington regarding that?
Yeah, I'm not 100% sure on that. I know we have a lot of mobile testing locations that people can get tested. But from what I've heard, it's difficult to get in. You have to have a prescription from your doctor to get a test. So if you don't exhibit any symptoms, I think it's a lot more difficult to get a test. So I think it makes it a little bit harder for people to get people moved in because they can't get those tests unless the person is sick, which at that case, they're probably not going to be moving in here. So.
Yeah, I'm looking forward to when the test is available widely for people to know if they've already had it, because I think I've already had it and my family would have too by now. So it would be lovely to know that, because then I can be a foot soldier on the ground helping other people.
Right.
But that will come. So we're looking forward to that. So Josh, tell us, this is a question that we're asking people to look forward. Standing 1 year from today, looking back, what would you like to see have changed in the world given our situation today? What do you hope people have learned?
That's a deep question. I thought we were talking about supplies.
Yeah, I know.
I think there's going to be a lot of change that happens. I think one of the cool things is community. I really am taken back, at least in this Facebook group that I have, of seeing adult family home providers stepping up and helping other adult family home providers. Like, one house doesn't have face masks. Someone's like, oh, give me your address. I'll send you 10 in the mail. One house is like, oh, I don't have this. The other house is like, how can I help you? I think this is definitely bringing the community of adult family homes closer together. I've seen a couple of cool things with a couple of local businesses. So down in Clark County, like Vancouver, just outside of Portland, Oregon, but still in Washington, there's a couple of businesses that are nonprofits. One's called A Caring Closet and one's called In It Together RN. They're a nurse delegation company. And those two companies have partnered together, and they're taking PPE to every adult family home that they can in Clark County, which there's about 300 there, for free. So they're taking them, whatever they can get, face masks, hand sanitizer, wipes, toilet paper, all this stuff. So they're taking donations and they're just dropping it off as like a care package. It's amazing. And I think if more companies can step up and do stuff like that, then I think we'll be doing pretty good. Besides Soundview, I also have another business called Synkwise, which is a software company for adult family homes. One of the cool things that we're doing with Synkwise is we have a free COVID-19 resource center. So I have all the information that we can come across specifically related to Washington at this time, all in one spot. So we can put a link to that in the notes as well. There's a password to sign into it. It's just the name of the company. It's Synkwise with a capital S. But Synkwise is another way of change that I see happening in the future, which is a lot of these homes going more electronic. So with this, we're seeing a boom in it right now of people being able to manage their home remotely. So they can do everything that they do day to day, pen and paper, like care plans and assessments, and their EMR with their pharmacy and ordering supplies and doing all this stuff. And they can do it from their phone, from their house. Like they don't have to leave anywhere. So I see adult family homes changing over this next year, being able to do stuff electronically like this remotely. The whole market's going that way. Skilled nursing facilities are required to do software like this. In Washington, adult family homes do their Medicaid billing online. They do all their background checks online now. So the market's kind of slowly going that way. So I see over the next, 1 to 5 years, it possibly being a mandatory thing, not just here, but kind of across the country. So that's one of the things that I see changing. What else?
That's great. And I love, and we'll put the links to those if you'll send them to us. We'll put the links to those donation sites. And I think we had someone post such great collaboration. Love it. I think we're seeing all kinds of people really stepping up. And I love to hear the individual stories like this. And glad to know that people are doing that. Way to ignite hope is what I say. I think that's wonderful. So Josh, tell our audience if they have questions for you or would like to get to know you and what you're up to with both of your companies. How can they get a hold of you?
Yeah. So I'll put my contact info in the note. Oh, there's some of my contact info right there. But yeah, I'm available all the time. I'll give you guys all my info, my cell phone, my email, my Facebook, my everything. So yeah, I'm working for adult family homes right now, right? I want to see people get the supplies that they need, whether that's their basic incontinence supplies that we normally supply them with, or PPE that we can't get them but can help them find somewhere else. We just want people to, get what they need. So
great. And keep in mind, our audience, that they don't just work in Washington. You work in what states? Remind our audience.
Yeah. So for Medicaid supplies, for incontinence supplies and urological products, we're in Washington, Oregon, Idaho, Montana, Wyoming, Utah, and Colorado. So incontinence is the biggest thing that we do at Soundview. We do it kind of two different ways. Either clients on Medicaid and they're low income and the state's paying for it, or they're private pay and they're paying for it themselves. So if it's Medicaid, there's lots of choices out there for people. The thing that you want to look for a Medicaid client is the quality of the product. All companies get paid the same amount no matter what they give out. We look at it as people are on state for a reason. They don't have money anymore, and the state pays us good enough that we can afford to give them better stuff. So from the get-go, we give them the best quality that we can afford to, where a lot of other companies give them the cheapest stuff that they can to get by. So we want to pass off all that quality to the consumer, to the client. On the private pay side, we're cheaper than the big box stores. We deliver right to the homes for free, make it easy. And then anywhere else in the nation, if you need supplies and it's private pay, we can go anywhere. Most supplies are shipped out next day.
Wow.
Free samples of products, next day delivery, great service. So we just want to do better for our clients. So better products, better service, better choices. So that's Soundview.
It's great integrity on your part to offer high quality, given the reimbursement that you get from Medicaid. And boy, I wish I had known about you last year or the last previous 4 years when I was buying like crazy from Costco. Well, so Josh, thank you so much for your time today. We appreciate it. Keep us posted on things in Seattle, and we wish you and your family good health.
Yeah, thank you very much. Thank you for having me.
Thanks, Josh.